There are some very difficult topics, and I'm not sure yet that we've figured out where we should teach these topics, but they should be done in clinical sites as well as on campus. Interpersonal differences, very, very, very important to understand what those are and to have ways of working with that conflict. Fear of change, we all fear change, and how is it that we manage it in a way that is not threatening, either for your job, or for your salary, or for your family, or for the way in which you have organized your workspace within the hospital or within the health system. Stereotypic rivalry, very, 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 very big problem. Begins as a kernel in grade 2. Stereotypes begin very early, and they are incredibly difficult to erase, but we've got to do it. Power, income, and status, everybody recognizes this. This has to do with who you are in the workforce, where you are in the workforce, what your education is, etc. And then language. There's the secret code of every guild. And then, of course, there are secret codes between those who want to share some of the secret codes, but not all of the secret codes. And then, of course, there's gendered language. There is this language difference, and we have to be very sensitive to it, and as yet, we have not really looked at it in the healthcare system. And in order to understand interprofessional, we have to understand the complexity of that interlanguage. And then the third thing that I think we have to think about very carefully in erecting interprofessional education is for our students to understand the sociological, psychological, and legal issues that have to do with practice. I don't know whether your students leave knowing, that registration is because of, legislation is because of, and that scopes of practice is not to include everything in the world that you could possibly think of. Our students, by our I mean our students, have very little idea about sociological, psychological, and legal issues associated with practice. And they need to understand if they're going to work interprofessionally. Let me now give you the definition. Interprofessional education occurs when two or more professions learn about, with, and from each other, enable effective collaboration to improve health outcomes. I want you to note that this is not a sound bite. I also want you to note that there is no hyphen in the word interprofessional. The hyphen in interprofessional is gratuitously placed there by Word, thanks to Microsoft. Interprofessional health education has no hyphen. When I read some new soundbite on my latest Google alert that has a hyphenated interprofessional, I think, I'm not going to post this. These guys haven't read anything yet. All right? So first, get the right word and get the word right. We have to develop the pedagogy both on the campus out there and on this campus about this learning process, about, from, and with. We have to develop that pedagogy. We have to know what it is in a diabetes clinic where we have 6 or 7 different health professional students gathered together, what it is that we want them to learn about each other, what it is we want them to learn from each other, and what we want them to learn with each other. And these are 3 different words. They are not synonyms for the same thing.